COVID-19 cases are spreading across Massachusetts faster than at any point since mid-May, the height of the state's outbreak. More than 1,000 new cases have been confirmed over each of the past 3 days, with more than 1,200 today alone. 13 communities are rolling back some reopenings after at least 3 weeks designated as high risk by state guidelines. And as the virus continues to spread, the state is acknowledging that its contact tracers don't know the source of about half of all infections in our state. And nationally, the situation is even worse, with well over 83,000 COVID cases confirmed on Friday, the most in a single day ever. And yet, the very next day at a campaign rally in Ohio, which has broken its own case record 4 times in the past week, Donald Trump had this to say.
On November 4th, you're not going to hear the news. The CNN, all they talk about, COVID, 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 COVID. All they talk because they're trying to scare everybody.
Callous, just nauseating. And then there's Vice President Mike Pence, the head of the White House Coronavirus Task Force, whose office is now the source of a second outbreak in the White House after 5 of his aides, including his chief of staff, tested positive for COVID. But instead of quarantining, which CDC guidelines say to do for people conducting non-essential work, even after testing negative, Pence has carried on campaigning in front of large and distance-free rallies, like this one last night in North Carolina and today again in Minnesota. But I guess that makes a lot of sense, given the strategy White House Chief of Staff Mark Meadows laid out yesterday.
We're not going to control the pandemic. We are going to control the fact that we get vaccines, therapeutics, and other mitigation.
And in case you thought that was just a slip of the tongue and not what Meadows really meant, reporters asked him today if he wanted to clarify. Here was his response.
We're going to defeat the virus. We're not going to control it. We will try to contain it as best we can.
You know, if only there was some magical piece of cloth that you could put across your face to help contain the virus as best we can while we wait on a vaccine. But as Dr. Fauci and other top infectious disease experts have repeatedly warned, even when we do get one, it likely wouldn't be available for the general public until the middle of next year, and will likely still need to wear masks and social distance into 2022. I'm joined now by Dr. Nahid Bhadelia, an associate professor at Boston University School of Medicine and the medical director of the Special Pathogens Unit at Boston Medical Center. Doctor, it's good to see you again, as always.
Jim, good to see you.
You know, the mantra from the president has been, we are rounding the turn. Of course, he doesn't say there's a Mack truck headed in our direction. How troubling in reality are the trends on the national level?
Well, Jim, I'll start with a personal anecdote. I had a conversation with my parents who fit the criteria for being vulnerable this weekend, very seriously talked about what's coming because I'm frightened, for a couple of reasons, because as you've noted, huge parts, almost every state in our nation has reported increasing cases, but then almost 40 states have reported hospitalization increases and deaths, which are a lagging indicator. 20 states have reported increasing deaths. Not only that, but in some states like Utah and in Texas, some areas are quickly surpassing their capacity to take care of new patients who are coming in, requesting field hospitals, as El Paso did, or looking to basically triage medical care, as parts of Utah are starting to do.
You know, I know you're one of the authors of that John Snow memorandum in Lancet debunking the herd immunity thesis, or herd mentality, as the president calls it, from this Dr. Atlas, who's his chief advisor. He's also the guy that tweeted till it was taken down, wear masks. No. When you read stories or studies out of places like Colombia, where they suggest that anywhere from 130,000 to 200,000 of the deaths to date could have been avoided had our leaders acted like grown-ups. Do you buy the numbers? Are they real?
Well, I definitely think the Achilles heel for our response here in the U.S. was not our lack of resources. I mean, we would have been constrained because this is a pandemic. Our failures are very much tied to our leadership. Jim, as you know, in West Africa, I was an Ebola treatment unit physician in that response to the epidemic in very low resource areas. And when I got back, I would say where you're born seems to determine if you survive the disease. And I like to amend that. It's not just where you're born, but it's under whose leadership you live because I do think that this administration has confused the issue. And the main issue is that they've conflated the public health mitigation measures like wearing a mask, that physical distancing, reducing crowd sizes with lockdowns. Nobody wants lockdowns. The way we avoid lockdowns is having a unified strategy and wearing those masks and keeping those distances.
Since you brought up your time, I think it was in 2014 in West Africa, dealing with Ebola, you tell an incredible story that you retweeted out from something you wrote at the time about having an elderly man who was extremely ill in your arms. And you asked him his name, and he said twice, "I'm nobody. I'm nobody." Why did you choose to retell that story?
I think one of the efforts that this administration has made is to somehow justify that there were any number of deaths that could have been preventable were actually justified to reopen economy. We do have to balance both. But what we know is that to do that, we actually, to open economy, we have to reduce the suffering. We have to reduce the deaths. In that effort to do that, to justify those deaths, I think that this administration at times has told us to just forget about those deaths. Those were justified. Don't worry about it. In effort, what this administration is trying to do is to make those 220,000 people, potentially more, because we think that there might be other, excess mortality that might actually be second. Above and beyond what we expect on COVID that's been diagnosed, could be from COVID. They're trying to turn all those deaths into nameless folks. And we can't do that. It is through grieving, it is through recognition of the loss of this nation that we move forward with a humane strategy that balances both of those activities.
Doctor, you said leadership is a critical issue. Let's come back to the state. And we actually have a government leader who believes in science and follows it as best we can. But it seems to me as a layperson, the trends in Massachusetts are just as troubling as the national ones. Do you share that perspective?
There are things that I think are putting us at higher risk. Yes, our cases are going up, as you mentioned. Our hospitalizations are also going up, as is our test positivity. And there are things that the state has done that have been great, which is offering free testing in high risk areas, ensuring that we roll back those openings. There are still steps that we could take that could be better. One is we need to double down on that contact tracing. As you said, we don't know where half of these new cases are coming from, and that contact tracing can really help us understand what the high-risk spots are. The other is, we're trying to do this sort of game where we're trying to decrease or roll back openings only in high-risk areas. That doesn't always work when people live in one town and work in another,
So what should we do?
We should have a bit more broader. We should be a bit more aggressive at rolling back reopenings, not just for high-risk communities, but also those surrounding it.
We're about to enter a traditional seasonal flu season, as you know, much better than I. Here's what Governor Baker said on October 13th.
We've done the work. We're prepared to respond to this virus like never before. But our preparations are of little use without the people of Massachusetts continuing to do their part.
Obviously, the second half of that statement is undeniable. I'm not sure I know what the consequence of the first half is. We're prepared to respond to this virus like never before. 1,200 cases, highest numbers since May. What does it mean that we're prepared to respond like never before, Doctor?
I do hope that it means that we're putting in more resources into the things that we know work. A part of this is the technical aspects, like increasing testing and contact tracing and ensuring that our medical system is prepared. But the other is to really pandemic fatigue is what's hitting us. Jim, the things that protected us over the summer, the increased humidity, more hours of UV light, those things are disappearing. We're moving indoors. And so all of those will be important. But I do think part of what this signals is that that Massachusetts will strongly look to make sure that we don't have to get to lockdowns. And if we do, those lockdowns will be driven by science.
There was a story in the Globe over the weekend where a number of your colleagues both praised the science focus of the governor, but also criticized him for not being as forthcoming, as transparent as they think he needs to be. Specifically, they talked about we should know, the public should know, people like you should know what the triggers are for greater restrictions, potentially more lockdowns. You're nodding in agreement. Why does that matter?
I think it matters because it shows that our actions are leading to these metrics, right? And if we know what the upper limit is, there could be greater planning. Parents can decide what's happening with their kids' schooling. If we know, what metrics will be used, businesses can know that what's coming down the pike and plan accordingly. We do need to know that. Partly I think it's because there hasn't been that national leadership that provides those kind of guidance. Each state in some way has been left to their own devices, but at least within the state, we could be more transparent.
How fast if there's a different president come January 20th, how fast do you think he can turn around the Titanic? How fast can he change this?
The thing that worries me is that, there's still going to be a period after election up to January 21st, where that might be the worst weeks of our pandemic. And that's where we need the leadership. And so I do think that we're in for a rocky road if this current administration continues down their plan to just ignore the virus or justify the deaths, right? When the new administration comes around, I think the things that they would do are the things that we need, which means that we need to have a more national, federal vision about how resources can be distributed, how states should be planning, but also to have efforts like ensuring that there is a nationalized workforce, the reserve workforce that can be, deployed where they're needed, rather than places having to go into a crisis standard of care. That's gonna take time. And the next 3 months, it's up to us. There's no vaccine yet. It's our actions. It's those masks, that physical distancing. It's making sure we don't gather in large groups so we don't keep transmitting this disease.
Last thing, we only have a couple of seconds left. Thanksgiving is a month away. Everybody's already making their plans, either pared down or saying, I've been away from the people I love for far too long. We're going to take a chance. What's your recommendation to families doing that planning?
I think a huge part of that is a risk assessment of who's vulnerable in your family. And if you can reduce the number of people and introduce testing and quarantining beforehand, you could make it easier. But maybe this is the year that we pare it down and hopefully make up for it next year.
I'm with you. Dr. Bhadelia, it's great to see you. Thanks so much for your time, as always.
Thanks, Jim.